So for our leadership panel, we have the privilege of having three wonderful leaders in nursing come join us. Firstly, we will have a presentation by Linda Silas. She is the president of CNFU. Followed by that, we'll have a presentation by Dr. Farah Laurent. She is an international nurse coach. And then we'll have a presentation by Dr. Tracie Risling. She is the Canadian Nursing Association's president-elect. And then after their presentations, you all will have a chance to ask them questions and have an interactive session. To start off, we'll have Dr. Silas. She is a leader of Canada's largest nurses organization and is recognized as the foremost advocate on behalf of nurses in Canada. She has fine-tuned her skills as a union leader at a local, provincial, national, and international levels over the course of 3 decades. Prior to being a CFNU president, she's actually served as the president for the New Brunswick Union for 10 years. She's a passionate speaker who's straight talking in both official languages, kind of inspires nurses and earns the respect of policymakers and stakeholders across Canada. She really advocates for greater understanding and action on social justice, social determinants of health, and key policies that enhance socioeconomic equity. And she's also a current national stakeholder for CNSA. And without further ado, I will hand it off to Linda to start us off with her wonderful presentation.
There, I'll unmute myself before I share my screen. It's lovely to see that there's so many of you there. So let me share my screen and correct my bio. First of all, it's way too long. I have to make sure that my communication team changes that. And I do not have my PhD. I'm simply Linda Silas. So pleased to be here. Now, how come it? Oh, here. Let's see if this is going to work. Is it working?
Yes, we can see your screen.
Okay, there. Okay, perfect. So again, a big thank you. I'm so proud to be here with Farah and Tracie. It should be a good hour and a half. And thanks for the invitation. As you know, almost all national offices are located in what is called today Ottawa, but it is the unceded territory of the Algonquin and Anishinaabe people. I'm very fortunate to be from New Brunswick, which is mostly the land of the Mi'kmaq people. Now, before I start, because it is hard to understand, what is the Canadian Federation of Nurses Unions? Other than being the largest nursing organization in Canada, I would even bet we're the largest nursing organization in North America. So we're always in competition with the US, simply because the US doesn't have much unionization. They have 10 times more nurses than we have, even more than that, honestly. But the unionization in the United States, it's about 16%. And the unionization in Canada is between 80 and 90%. So in Canada, when you get a job, a permanent job in healthcare, either community long-term care, or acute care sector, the job is already unionized. So we don't have many organization drills, even if there's a few non-unionized. So that's where we stand. So we have every province represented except Quebec. Like any national organization, there's always this little asterisk that we work with FIC, the Fédération Interprofessionnelle du Québec, but they're not actual members. We don't represent the territories. The territories, it's because they're all under federal jurisdiction. And again, work with them, but they're under federal jurisdiction. And in the corner there, you see CNSA. Very proud. We're the first organization to welcome CNSA, part of our members. Tiffany Your president sits on my board, and I always say it's one of the best decisions we ever made. Now, when you talk about leadership, there's different levels of leadership. You'll hear Farah and Tracie in a minute. But for me, leadership is about listening. It's about informing yourself. And informing yourself, it's either going in the workplaces, in the locals, and meetings, like the annual meeting you will be holding in January. And it's about making connections. And for CFNU, it's through Global Nurses United. I just came back Tuesday from our meeting. We had 28 countries sitting around the table and discussing workplace issues, also climate issues. That's one of our key issues. But it is about learning about others, sharing resources and ideas. I always say my best ideas were stolen somewhere. And if you're in the room, I give you credit. Other than that, they're all ours. But it is important as leaders, regardless if you have a title or not, we all have in our inner circles, inner self, a leader's position. And it's the first thing to do is to listen. And then for CFNU, Canadian Nurses Union, everyone understands that. I usually don't have to read a bio of a page on explaining what we do. People understand union. It's about collective agreement, occupational health and safety, professional practice, advocacy on social issue, better life, better care. When we say better life, better care, it's also the child care, pharmacare, the environment. What do we do on that? So it's what our members tell us to work on. That's what we work on. Because that's what's important. When I say we're 250,000 plus members, they pay my salary. They all pay a dues every month to make sure that their provincial union and their national organization function. And we need to listen there. How do we work? One of our biggest success is both the annual meeting of premiers in the summer. We have an audience with them. We have a policy breakfast. This year it was in Halifax, and it was all about access to care at all age. So we had a nurse practitioner, we had a doctor talking about primary health care, and we had a specialist around long-term care talking about access to care is at all ages and how do we improve it. So for us, it's really putting little seeds. This is Premier Ford, for example, putting little seeds in his mind saying healthcare is more than the hospitals. We have to make sure everything is well funded. And that's where we go. You see Tiffany right there. So this is one of our successes. It's also one of our biggest tool. When we look at health ministers, the meeting was supposed to be held this month, but there's a provincial election in Nova Scotia. And so it had to be canceled. And now we're going to see where it's going. But at these meetings, what CFNU does is we make sure that we are united front. So we invite the Canadian Medical Association, the Canadian Nurses Association, CNSA, of course, they're part of our board, so that's an automatic. The Cousins, the schools of nursing, just to make sure that, we might have one message that's more union oriented, but when we're talking about the welfare of nurses, the welfare of patients, we're kind of rowing in the right direction. It's important to do that. So remember I was talking about we have to listen, we have to get informed. Getting informed is, I mentioned, I'm not a researcher, I don't have my PhD. A little bit of myself would have wanted to do that, but I guarantee you there's not enough hours in a day to do it. But it's to partner up with different researchers to look at building up the evidence. So when I speak on the behalf of nurses, it's not only what I've heard, it's building on the evidence. So I can really show to the politicians, nurses need this, and this is why, because Dr. So-and-so, all the letters behind his or her name, have validated it. And this one is on a national pharmacare program, making the news lately. I'm also making the news because I've just been appointed to the expert committee to make this national pharmacare program, Bill 64, a priority across Canada. The only nurse with one pharmacist and one doctor and two science economists. I'm quite proud of that. Now, if you want to know about the ins and outs of a collective agreement, go on our website. It's the most viewed page on our website, nursesunions.ca, and it's where the wages are. So you have a little snapshot there. The lowest wage in Canada are in Quebec by no means, and then the entry wages. And then you have British Columbia, Alberta, always in a little bit of a competition. The Atlantic provinces kind of stick together on those wages. But beyond that, there are more premiums, like night shifts, evening shift, in charge. There's also premiums if you hit 10 years, 20 years, 15 years. They're all different. So it's all there. So with all the premiums you can get, 13, 14, $15 more an hour, depending on when you work. But the information is there for you. And this is by our chief negotiators that meet twice a year to look at all that. Now, Indigenous health. I should slow down because we really need to be calm and reflective on what we need to do with Indigenous health and how we better do our job. So CFNU as being the largest nursing organization, but also representing the direct care. I always say I represent the working nurses, and my board gets kind of upset because they say, well, I'm a working nurse too. I'm also a working nurse, but I guarantee you I'm not there at 2 a.m. I'm not there when patients are dying. I'm not there trying to pull both ends together. So we represent the working nurses that are there all the time. And what they're telling us is that we need a national apologies on what we've done wrong, and we need a plan of action, a pledge that we will do better. So I'm quite proud to announce that CFNU has embarked on this, and we will be doing all of this the first week of June at our convention in Niagara Falls. And it's quite important. We've built an advisory committee of Indigenous nurses. We're doing the research with Dr. Lisa Burtskin, a Cree Métis nurse, I think from Alberta, working in Victoria. Lisa's been around many years, is working with us to make sure we do this right. So more on this, but quite proud of our project there. Of course, climate nurses, and it's mostly young nurses, not to say that the spicy nurses like myself are not worried about the planet. Guarantee you, I live in New Brunswick, and during Fiona, almost 3 years ago, my house was surrounded by the ocean. The waves were hitting halfway through the window. That became a shock for everyone in New Brunswick where, okay, the ocean is way too warm. It cannot absorb what's happening in the environment. So we build this toolkit, and we need to do much more towards our responsibility for Mother Earth. I am proud, and I'm sure somebody at CNSA announced it, but you just signed a partnership with a youth organization looking at what can we all do for climate. Talking quite fast, make sure we have time for everyone. I should have checked. If you have translation, I'm apologizing. You have translation? Yes, no, no? Okay, okay, good. Because the translators will say, Linda, calm down. So this is the latest report. We came out, the agency report, opening the black box. And I know some of you are thinking, oh, Linda, I'm quite excited to go into agencies. Sorry, it is not the area to go. First of all, the provinces are going to walk away from them. So you're going to lose 2, 3 years, whatever, of seniority. If I look at Manitoba, they've already created this casual pool, which is honestly what I had when I graduated way back when. They orient you to 3 departments or a different hospital or whatever, and they pay you if you have to go to a different place, similar to what the agencies are doing. But the problem with the agencies is you have about 240 of them in the province, in the country, I mean. And there's no regulation, no transparency, no accountability. Nurses sign up, go in the hospital, leave, and it is really creating a havoc in our places. So Dr. Joan Almos published this report, and she said, Linda, I've never been so busy doing media interview, because all of a sudden it wasn't a newspaper that was saying a nurse is getting paid $319 an hour. It was evidence, nursing evidence, but very practical and went through all the rigmarole that researchers have to do to publish that. So we're not done with it. It is important to continue. Our role in all of this is to create great jobs. When we all graduate, we want a great job in our community to build families and stay there. So it's important. Talking about great job, Dr. Kim McMillan from Ottawa U is working on right now the working title is The Modern Nurse. What my board, which is about all my vintage, except Tiffany. Tiffany's not as spicy as us, but realized that when I became a nurse, I wanted a permanent job and I wanted a pension plan. And I really wanted stability. What our new nurses are saying, well, Linda, I'm not sure I want a pension plan. I'm not sure I want sick leave. I'm not sure I want long-term disability. And I don't know if it's my mama bear or my experience is saying, okay, red alert, because you never know when you're going to be sick. That's the sick leave and long-term disability. And the other is one day you will be 55, 65 and you'll want to retire. And we can't go back in the 70s when women who worked all their life retired in poverty. So we really have to look at what do our new group of nurses want into a career so we can incorporate that in the bargaining strategy. So Dr. McMillan is doing that. The report will come out next June, and we will be presenting that to the premiers in the summer. The IENs, again, very important part of our workforce, but how do we recruit them ethically, fairly, and then how do we make them welcome and practice safely? So we hired a group of researchers to work on a pathway for IENs, and that will be presented to the members of Parliament in February and then launch after that. SOS Medicare, that conference is coming again in February because we're also getting ready for my next slide, which is, are we going to have a federal election? We as organization, as leaders, we have to mold those politicians into something we need and want. So we'll see when it comes, but we're getting there. Staff Up is our current campaign because not only you listen, you build your evidence, you meet the politicians, but you have to have a campaign on the side. And this is really, you remember with the Ontario Nurses Association, the union in Ontario, when they won the challenge around Bill 124, where the government freezed their wages at 2%, and they were able to contest it and get wages at 11%. And now everyone's working towards, it's not only about wages, it's about how do we have proper staffing. What is also important, that's another campaign of ONA, is that we put this staffing, we put this voice of nursing equal to the respect of the profession. Some of you might have heard me before. We are intelligent healthcare professional, and we need to be treated with that respect. And too often we have nurses saying, oh, I'll stay and work 18 hours. I'll stay work 24 hours because I care and dedication. My friends, dedication will not pay your bills. And all of that will just make you sick. So we need to look at nurses as professional individuals with rules and regulation onto what we do, including our work. And it's all about, you're not a hero. You're not an angel of mercy. So if you think you are, or a professor told you, say, Linda Silas told me to clip those wings and get rid of that halo because I'm a professional worker and I have rights. So we're working very hard on that. Biggest project is nurse-patient ratio. It's nothing new. We've been working on this for 20 years. We're having a big international symposium this week coming up, and it's about retention. Nurses are telling us, one, I don't want to work in direct care because I'm overworked, I can't do my job. And the spicier nurses, the nurses with experience, which are really like the security blanket of nursing for patient care, are saying, I've had enough, I'm leaving, retiring. So our job as Nurses Union is to speak up for you and to make sure that it's more than negotiation or grievances. A grievances is when your employer did wrong, Disciplinary action is when you did something wrong or potentially wrong, and that's how we see unions. But nurses unions, we have that whole professional practice that we build around that. And I can be as loud as I want. I guarantee you, I can be loud. But what I cannot do is do it by myself. And that's where we try to get every of our members and the students really speak up and speak out loud. Doesn't mean that you get yourself in trouble, but it means you speak up and stand for your rights. Right now, I think Yasu talked about it when I looked at this morning's agenda about our survey. It's going to be the only and the biggest nursing student survey. Here's the QR code if you want it. And the preliminary report will be in January at the CNSA annual meeting. Quite proud of that. Now, to conclude, first, I really don't want you to get discouraged. You hear all these reports and you'll hear more. Nursing is pretty much, I can say it Saturday today, a shitty place right now. But we can't get discouraged and we can't quit. Because when I graduated, there was no jobs. And the BN was a brand new thing. Only 6 of us got jobs, casual jobs. Then the 1990s, you might have heard stories. Everyone was leaving for the US because nurses were getting laid off. And then all of a sudden, governments realized, we don't have enough nurses. So the beginning of the year 2000s, it was jobs, jobs, job, money, money. Like we negotiated 36% wage increase because they needed to recruit. Then we hit the pandemic and now we're back into a severe job shortage, which I think this job shortage is going to change the way nurses do their work in regards to working hours, etc. But we can't get discouraged because we need to really build the best jobs in our community in healthcare. Now, some of you are probably saying, yeah, Silas, look at you. You've been around for 100 years, which is probably true. But when I started my full-time job as a union activist, as provincial president in New Brunswick, I was 29 years old with he was 13-month-old baby and single mom. So, there is a chance for everyone in the movement. We just have to make sure we work together and that we stay focused and stay positive and ensuring we all do. So I think my 20 minutes is up right now, and I'm looking forward to hearing Farah and Tracie and answering your question following all of this. Merci beaucoup.
Thank you so much, Linda. If students have questions, we do have a Q&A panel at the end, so save your questions for then. Next, we will be having Dr. Farah Laurent. She is a nurse career coach and a dynamic speaker who is passionate about empowering nurses to achieve their career goals. Farah has helped over 100 new grad nurses into specialty positions all across Canada and US with a background as an emergency nurse, educator, and a professional development expert. Farah is a true trailblazer in the nursing industry. She's not just changing the game, she's transforming the entire industry. She has a podcast and also a LinkedIn live show called The Nursing Dose with Farah. Dr. Laurent also serves as a committee member for the National Association of Women Business Owners and serves as a mentor for the Canadian Black Nurses Alliance. And with that, I will hand it off to you, Farah, to take the floor.
Thank you so much. I really appreciate it. I'm so excited to be here. Let me know if you could see my screen okay. Can you see it?
Yes, we can see it.
Your screen's visible.
Okay, awesome. So basically, again, thank you for the invitation. Today I want to talk to you about the audacity to lead, okay? So we're going to get into it. So it's going to be kind of interactive. I need you guys to kind of put comments in the chat, and I'll be asking you to put some numbers in there. So do you have the audacity to believe? That's kind of my question. Right now, we're in an interesting place in nursing. I think globally, We have to really believe that we can make an impact, right? And really change nursing and healthcare globally. So if you believe, please put one in the comments for me. All right. So I want to share a little bit of my story, right? Story time. So I graduated from the University of Windsor about 20 years ago, and I had a great experience in nursing school. However, in my last semester, I had a particular clinical instructor that told me that I would never be an emergency nurse. She literally laughed at me and said that she said, Farah, you should go to med surg, like they typically tell us to do. So I was not in agreement. I hated med surg. And I said, watch me, I will be an emergency nurse. So not only did I go into emergency medicine as a new nurse, I got hired as a nursing student. And not only did I get one offer, I got two offers. And this was 20 years ago. So this is why I really want to empower nursing students and all of you to really don't settle for the status quo. You're going to hear a lot of negativity along the way, but just make sure you surround yourself with people who are uplifting and you really pursue your dreams and pursue what it is that you want to do. So I stayed in Canada for about 5 years. I did emergency medicine. I loved it. I had great preceptors. However, you have to really be able to advocate for yourself as a new nurse, and be able to navigate all the different, challenges that come with nursing. Not only are you learning the profession of nursing, but you really have to advocate for patients. There's a lot of things like structural racism that we're dealing with. So really being an advocate for your patients and for yourself is extremely important. So fast forward, I actually ended up moving to New York City. I got married. I did travel nursing over there. And along the journey, it was not always easy, right? I got my master's in education. And then I had a manager tell me that I could never be an educator. I didn't have the soft skills to be an educator. So of course I didn't listen to that, but it took me 2 years. I finally became a clinical educator and a clinical instructor at NYU School of Nursing because of that memory that I had in nursing school. I promised myself that I would go back to school to be a clinical instructor so I could be an inspiration to nurses, particularly nursing students. So I love that job. And I really inspired them to really take action and do what it is that they wanted to do. So along the way, you're going to have challenges. You're going to have a lot of adversities. But make sure that you stay positive and you stay true to your goals. And don't let people kind of let you deviate from that. Fast forward, I ended up getting my doctorate in nursing practice and organizational leadership. And in my doctoral program, I was actually going to school full time. I had two small kids. I started a business as a career coach and I was in this DNP program. And of course, it was not easy, but I really pushed myself to get there because I thought, I'm a first generation immigrant. I was born in West Africa. English was my second language. And I share these things because I'm very proud. I know some of you may be immigrants or, daughters or sons of immigrants. And it's very important for me to continue education, and to really show nurses that, there are many ways and many paths to get where you want to be. So just surround yourself with positivity and don't give up. So that's kind of my message, to you all. And then fast forward, not only did I get two scholarships? I got a doctoral scholarship from the Emergency Nurses Association and the Society of Trauma Nurses. And I'm now a peer reviewer for the Journal of Emergency Nursing. So talk about 360, right? So, it's very important. And the biggest advice that I have for you is just to continue that advocacy and surround yourself with really positive people. All right. So are you ready to lead? If you're ready to lead, put lead in the comments. Okay. So I have this acronym that I want to share with you. Okay. So leadership, emotional intelligence, being adaptable, and dare to be bold, right? So what does this mean? So obviously this panel is talking about leadership and how to lead. You may be thinking right now that you're a nursing student and you're like, I don't really know if I have a lot of impact and if I can really lead, right? Let me know in the comments if you believe that you're a leader right now. Put 7 in the comments if you feel that you're a leader. Okay, do I see comments? Okay, good, awesome. So basically, my point is leadership has nothing to do with the title. And I'm sure some of you have heard this before. It's not about being a particular RN or having a leadership position. It's truly about having leadership skills that you build over time. So doing things like being a part of this particular event, going to conferences, having mentorship. I really believe in mentorship. It's huge for your professional advancement. And surrounding yourself with other great leaders will instill leadership skills in yourself. And you can lead from anywhere. You could lead as a nursing student, and leadership just literally means, there's different styles, but I believe in a combination of leadership styles. Servant leadership, you're usually serving others. And it's not about, right, being that kind of like aggressive leader. You could still be a leader, but still influence with grace, being charismatic. Think about some of the greatest leaders like Nelson Mandela and all these people, right? They had a very convincing voice, but they didn't really use like aggression, right? Second, emotional intelligence. Let me know if you've heard of emotional intelligence. Put in the comments, yes, if you've heard of emotional intelligence. Okay, and for those of you that maybe aren't sure about it, I would highly suggest that you look it up. But emotional intelligence literally means that you're in control of your own emotions and that you have a high emotional intelligence IQ type thing, like EQ, right? That you're aware of other people's emotions and you can manage them appropriately and professionally. So I actually had a hard time in the beginning of nursing with emotional intelligence. Um, I had to work at it, right? It takes time to really work at this emotional intelligence. So it's something that I encourage that you do look it up, because this will not only help you navigate the healthcare industry wherever you go, but it's going to help you in your own personal life, and it's going to help you with professional advancement, because those that have high emotional intelligence usually do well. They're able to handle stress pretty good, and it's just better for your well-being. And then obviously, you have to be adaptable. In today's healthcare environment, everything is changing really quickly. Things like AI, you have to just embrace the change because it's not going to go away. It's going to be there. So you need to be adaptable and be able to really change literally minute to minute. Being a former emergency nurse, and those that are interested in critical care, you really have to be adaptable. Same thing in leadership. You have to be adaptable and be able to take on, let's say certain policies, or and then be able to translate it to practice. All right. And then dare to be bold. This is extremely important. If you guys want to be bold, put bold in the comments. I know a lot of nursing students struggle with self-esteem, struggle with confidence, but if you want to be bold, you have to work at it, right? It's not something that you just wake up, being very confident. You have to work at it. So simple things such as speaking up, going up to people that you're not really familiar with and starting a conversation. I know there's a lot of introverted nurses out there, but make sure that you elevate your communication skills, because that's part of leadership as well, and that you're able to take bold action, because that is the only way that you're going to provide safe care for your patients and also progress in your career. Okay. If you like this acronym, put yes in the comments. I like to keep it interactive. All right. All right. So one big thing that you can do to be a leader is that you need to cultivate and have thought leadership. Even as a nursing student, you have something to say. You are the next generation of nurses. You need to speak up more. I know a lot of you are involved in like health policy, and there was a little bit of that was discussed earlier. So make sure that you get involved in professional organizations and that you go to meetings, you're in the room, and because we need more nurses at the table to make more decisions for our profession. Another important thing, the media, just globally, I think sometimes puts our profession down a little bit, and it's not seen as, this kind of glorious profession. But to me, we are in the best profession in the world. If you agree, put yes in the comments. I worked at NYU, and I remember working with the nurse. She worked per diem at a zoo. Literally nurses can work anywhere. You can work in a cruise ship, you could work anywhere. Remote nursing in the government, it's beautiful. You could work for the United Nations if you want. So I just implore you to keep up the positive image of nursing, especially if we want to recruit more nurses into our profession. We have to speak about it professionally and like positively. Yes, there are issues in every industry and we need to work on it, but we need to be really solution focused. So I just say that just be careful about the language that you use, because we want to recruit more nurses to our profession. All right. And then I always say, like, do you, like, be authentic, be yourself, again, advocate and be visible. Don't be afraid to speak up. And this is me speaking at a national conference. So it's very important to really get your message across. Okay. And then next, this particular opportunity for me is amazing. I love being able to speak to nursing students and new grads. It's my passion. It's what I do. So your theme of this conference or this event for Nurses Week is innovate, impact, and inspire, right? So for innovation, in order for any innovation to happen, you need to be able to take risks and you need to be solution focused, right? So if you're creative, most nurses are creative, you need to start thinking about innovative ways that we can improve nursing and healthcare. I don't know if you've heard, but in the US there was a big conference, I believe it was in Las Vegas. It was called Health, and there was a lot of startup tech companies, and they're just sharing their different ideas of how they're improving healthcare and in nursing. So I think it's really important to think about that. Next is impact, right? A lot of you may not know what area of nursing you want to get into. For me, I knew it was emergency medicine, right? And that's okay. However, I encourage you to follow the area that you want to be in. If it's working with babies, working with the elderly population, whatever it is, whatever impact you want to make, just be clear about it so that you can take that direction, right? So anytime you can assess and reflect on your values, your passion, you'll always be rooted in your purpose. So make sure that the impact you want to make, you reflect deeply on that. Don't just accept any job just to take any job, right? So if this is resonating with you, put impact in the comments, okay? And then inspire. The reason that I told my story and I shared quickly with you guys kind of my journey is because it's much more impactful and inspiring when people share their stories. And traditionally, right, children, even storytelling and things like that, we remember stories a lot more. So if you want to make an impact, start telling your story, start sharing your story, and you want to be the creator of your story, the author. Don't let other people create the story for you, right? So you want to be able to storytell, even if you want to change something in healthcare, like change results. Let's say there's high infection rates. I did this in the emergency department. We had high blood culture infection rates, right? Or contamination rates. I told a story and I said, well, how would you feel if you're not doing the right thing? And now these patients have to come back, be called, an inconvenience to come back to the hospital, right? So most of the time, nurses will do the right thing if they can relate it to a particular individual. Okay. So that's the importance of storytelling. All right. And then move forward. Who wants to be successful in their career? Put success, if you want to be successful in your nursing career. So one myth that I want to share is a lot of nurses think that the harder you work, the harder you work, the further you'll get in your career. I thought that myself. So, as nurses, we love getting advanced degrees. We love getting certifications. I had 6 board certifications, a doctorate, all this experience, but I still got laid off 3 times because of my advocacy and, different things in the last 3 years. So for those that are in union positions, which I know it's a little different in Ontario and, different provinces, it's unionized. That's great. However, if you want to advance, don't think that it's just about work performance. According to Harvey Coleman, this is kind of a study they've done. Only 10% of your work performance is going to help you advance in your career. What will actually help you advance is your image and exposure. So image is how others perceive you. So kind of like building your personal brand, which we'll talk about in a little bit. And then number 3 is exposure, right? Who knows about you and what do you do, right? So like basically, being involved in projects at work, talking to your supervisor, showing up looking professional, things like that will help you advance, right? Networking, whether it's on LinkedIn, online, or whether it's going to professional organizations or conferences like this, in person is going to be very impactful because when you meet people face to face, it's a lot more impactful. And that's just the way of the world. It's really who you know that will advance you in your career. And it's sad to say, but that's the reality. So you have to be able to adapt. All right. So pitch, please. Okay. This is something that I got from a speaker that I follow. Her name is Precious L. Williams. She is a speaker that speaks globally. She's actually spoken in Toronto and a bunch of places in Canada. But the reason I put this is because nurses are the worst for self-promotion. If you want to get an interview as a nursing student and get into a position as a nurse career coach, this is what I help my clients with. You have to be able to pitch yourself. And literally everything that you do is a pitch. You may not know that you're doing it, but you have an interview pitch. The way that you're talking about, let's say you want to advance in your career to your supervisor and get a promotion, that's a pitch. So you have to learn and be comfortable with articulating your value and being able to pitch yourself. Okay. Put pitch in the comments if you agree. All right. And then how do you stand out, right? How do you stand out in the workplace, in nursing, in your industry? These are a couple of things that you can do, right? So if you believe that you have a brand, put brand in the comments. So a lot of nurses don't think that they have a brand, but you do have a brand. It's just whether you're aware of it or not. So technically a brand is a reputation. And according to Harvard Business, it's basically personal branding is an intentional strategic practice in which you define and express your own value proposition, right? So you have to work on your image and articulating your value and being able to show up as a professional and an expert. Even if you're a nursing student, you have experience. I talk to a lot of nurses and they're like, well, the recruiter told me I don't have experience and I can't go to critical care. Not true. You have experience. You went to nursing school. You have tons of hours. So don't let that play with your mindset. Work on being more confident and articulating your value. Okay. Actionable steps. Invest in yourself. Invest in your professional development. Be able to articulate your value, meaning practice saying what you do, what certifications you have, what experience you did. Tell stories like, hey, I went above and beyond for this patient. I did this, right? I got this award. I was on the dean's list. It's okay to brag about yourself. In fact, I want you to brag about yourself. Put brag in the comments. Okay. And then, like I said, professional development is really key to advancement. And then build credibility. So quickly, I wanted to share this. I was on the Jennifer Hudson show. And this kind of helped with my business and my branding, and it built my credibility. The fact that they invited me on was huge. So it's just a quick, fun thing that I wanted to share with you guys. Okay. And then, really, in nursing, I want you to know that there's endless opportunities. A lot of times, as nursing students, we're told we can't do this, we can't do that. You could do whatever it is you want. There's a lot of nurses going into nurse entrepreneurship. You could start your own side hustle. You could start speaking. You could be a writer, an author. You could show up on podcasts and talk about what your thoughts about nursing and being a nursing student. You could start your own podcast. I have my own podcast called The Nursing Dose with Farah. These are ways that you can make an impact out there and amplify other nurses' voices or nursing student voices. Or if you don't want to start one, at least, write articles, be out there and share your thoughts and what you're seeing so that we can start making positive changes in nursing. All right. If you resonate with this, put 1 in the comments. Am I doing good for time? It was hard to tell.
Actually, we are going a bit over time, but
Okay, I'm
hopefully we're
done.
almost done. Okay, sounds good.
Okay, I'm done. I was just gonna say, basically, have fun in your career and be able to glow and be visible. And then this is it. Just you could take a picture of this for later, or just do the QR scan code. It's just to give me feedback about this presentation. And again, thank you so much for the opportunity. It was such a pleasure. So yes, if you could please take a moment when you get a chance to fill this out. All right. Thank you so much.
Thank you, Farah, for this amazing and motivational presentation. If you guys do have questions for her, we do have the Q&A period at the end. And our next presentation will be by Dr. Tracie Risling. She is the president-elect of the Canadian Nurses Association and the past president of the Canadian Nursing Informatics Association. She's also an Associate Dean Innovation in the Faculty of Nursing at the University of Calgary. With a practice background in pediatric nursing, Tracie leads a patient-oriented program of health and nursing informatics research, including study on artificial intelligence, social media, co-design, and the use of texting for wellness and workforce support. She's a passionate advocate for increased nursing engagement in the development, use, and evaluation of digital health solutions, which is reflected in her work with the new Doctor of Nursing program at the University of Calgary. And I will hand it off to Tracie.
Thanks so much. It is such a pleasure to be here, and I'm so glad to have spent this time with Linda and Farah as well. Hopefully, I can tie it all together here, and then we can have some time to move into questions. But I really just want to thank the CNSA for this great opportunity to join you in this fantastic day and celebrating National Nursing Students Week. This is the view from here this morning, literally out the slats of my blind this morning on Treaty 7 territory in Calgary. We are under a snowfall warning, our third in a few weeks, and yeah, it is a beautiful snowy day on Treaty 7, and Calgary is also home to Métis Nation of Alberta Districts 5 and 6. I also really wanted to share this capture if you didn't see it. This will be my first plug for you to follow the Canadian Nurses Association on our social media. This is a beautiful reel from one of our board members, Stephanie Gilbert, from our third annual Anti-Racism Summit this week. We had a busy week with the CNA, and I'm going to share a bit with you about how that went. But this is a quillig. It's an Inuit, it's heated oil if you've never seen it lit. And it was the most incredible moment because Stephanie and the elder lit the quillig to start the Anti-Racism Summit Day, but the elder was also her mother. And it was just the most beautiful moment, and the glow of it, as you can see. And I've actually had the privilege to be in a board meeting, and Stephanie will bring this and light it for us. And there is a really special kind of warmth. Oh, thanks for the snow shares. Yeah, Fernie, I bet you've got the snow. I don't know, we're out in the west here. We may be hogging the snow on y'all, so sorry about that. Folks, can we just take a second? How are we doing? Do people need to stand up? Do we need a stretch, a coffee, something? I just want y'all to take, these are some fantastic and energetic presentations from Linda and Farah, but I just want you to know if you need to, like, camera on, camera off, just take a moment, just as we kind of move through this session, make sure that you're doing what you need to do, okay? All right. Let me tell you a little bit about who we are at the Canadian Nurses Association. I'm trying to make my slides behave at the same time. Oh, wow. Okay. Going the absolute opposite direction. Let me see. There we go. The CNA is the unified voice of Canadian nursing. We represent all nurses are eligible for membership in the Canadian Nurses Association across all nursing categories, which is really amazing. And this board meeting in particular was a great opportunity to unite the voices of registered nurses, nurse practitioners, licensed or registered practical nurses, depending what part of the country you're in, registered psychiatric nurses, and of course, nursing students. And I'm going to show you some pictures in a minute from our week this week, and you'll see some familiar folks, I'm sure, that we have the opportunity to work in collaboration with Canada's nursing students. This is our mission, to make nursing better. That's it. It's simple, right? Not just for nurses, but for patients and for our public health system, which I think, as anyone in nursing school knows right now, is under some challenge, right? And then our vision is about progressive leadership, which is why I'm so happy to be on this panel today to chat about that again, because it's that leadership, the leadership of nurses, is the key to advancing our profession. And that's the great thing about nursing and being a nurse, is once we advance ourselves, we advance the health of everyone, and a healthier environment and a healthier society. And that's the absolute privilege of being a part of this profession. So Linda did a great job of walking through the incredible role that nursing unions play, and of course the CNFU. I see I have timings on these slides, which is my problem, so we'll see if we can make it work. But there are a lot of national nursing organizations at work for you, with you. And, really and you probably have walked through this in a nursing fundamentals class somewhere, right? The difference between regulators, educational associations. So the most national of those, the Canadian Association of Schools of Nursing, professional associations, and of course our unions. And you can see a bit here, and I'll be happy to share these slides out about each of the important roles that these groups play. Okay. So the CNA is really, again, about strengthening the role of nursing, not just for the profession, but for the healthcare system. And when I speak about the healthcare system, one of the things that we do at the CNA is really stay focused on the public accessibility of our healthcare system. So we do a lot of advocacy, right? Healthy policy at both the provincial level, sometimes the municipal level, across all provinces and territories, and of course at the federal level. And the other interesting thing we do at the CNA is that we interact globally. So our president and new CEO of the CNA were recently in Bucharest for the International Council of Nurses 125th anniversary celebration. I'm going to try and find a few things for you while we're chatting in the panel. One of those is a declaration, The Future of Nursing, that was released by the International Council of Nursing after 125 years, looking ahead to our next 125. So these are the things that we do to engage in nursing leadership. Aha, so we did not start our week with the third annual National Anti-Racism Summit. We started our week this past week on the Hill and in our national board meeting. And I think you're seeing some familiar faces here. Our CNSA student representative Anchor joined us. Of course, we have a brand new member, Matthew, who's likely familiar to folks as well. who is representing licensed practical nurses or registered practical nurses. And this is us. And now I'm going to fess up right now. And you're thinking to yourself, Tracie, aren't you associated with this organization? Why aren't you in this picture on the hill? This is a very good question. And this is because the Canadian Association of Schools of Nursing was having their also their council meetings these same 2 days. And I was finishing my last year as their chief electoral officer. So I was running back and forth between the Hill and my role as president-elect of the Canadian Nurses Association and overseeing the election for CAUSN as they had their council meetings and talked about the future of nursing education. It was a busy week, for sure. Okay, so I think when it comes to leadership, the CNA is really passionate about that. And I'm happy to talk in the panel too about our new Doctor of Nursing program at the University of Calgary. I was brought to Calgary specifically to kind of work with that program. It is about systems transformation because boy, do we need some across the board. And the CNA is really interested in leadership for systems change. We are interested in leadership at all levels and Farah said it perfectly. I could not do it better. You have the power right now. Please don't wait for someone to empower you. Okay? Nurses do not need to be empowered. Nurses are powerful. Nursing students are powerful. Every voice of nursing has the opportunity to step into leadership space and really to make change. I think we do it very well in nursing interprofessionally. And of course, we use evidence, right? We use science, the science of nursing. I know we like to talk a lot about the care of nursing, and I feel that in my heart as well. It is part of what drives me through nursing every day, but we cannot underestimate the power of the science of nursing. So if you want to get involved, the CNA has programs to help advance nursing leadership across the country. Inspire is one of our newest ones. You can take this program, probably not now, but when you're out in practice and you're thinking about next steps in leadership, this will be here for you. And we use leadership and the voice of nursing in advocacy. So we communicate with governments, we work with media, and we build coalitions, with other nursing organizations, with other health organizations. Linda was talking about her amazing role on the pharmacare discussion. I just finished representing nursing on the Canadian Medical Association Royal College Interoperability Task Force about a better digital health future. So I represented nursing there. It is really important for nursing voice to be at these tables. When we asked nurses a couple of years ago what they thought we should be advocating on, these are some of the things they said. And again, I can't do a better job than Linda about talking about the healthcare workforce. After the patient ratio summit and discussion next week, we'll also be in Ottawa at the Canadian Health Workforce Conference, representing nurses, talking about how critically important nurses are to the healthcare workforce and what we need so that we can do our jobs to make primary care better, to reduce wait times, to provide safe quality care, not just in acute care, but in every geographic location, every practice setting across the country, there is a nurse, okay? This is why this is so important. But this is what I want to leave you with. And I really want you to think about the differences between advocacy and activism. Okay, so we talk a lot about empowerment. I don't like that word because I don't think you need to be. And then next we talk about advocacy. And advocacy is important. It's about speaking out. But what I'm going to challenge everyone today to think about is activism. What if we speak out and we're heard, but there's no action from that? What I want you to do in activism is the follow through. So we spoke out, and then what happened? Right? It's not just enough for us to speak out anymore, I think, because there's a lot of voices out there. And there's a lot of powerful nursing voices as well. But what I want us to think about is the follow through. Okay? The follow through. This is two of my favorite follow-throughs also from this week. It was a really busy week this week. It was Digital Health Week, and the week before was Together Against Misinformation Week. I'll tell you, November has been a wild ride. But this is what came out this week. Is this position statement. And I'll put some links in again when we hop into the chat. Nursing practice in digitally enabled care environments, and then planetary health, which you can see this statement was released actually for Environment Day in April. These are our two favorite examples of the differences between advocacy and activism. On their own, statically, these position statements are strong advocacy positions for the planet and for nurses' role in a digital health future. But when we pick these position statements up, we read them, we find the one or two key points that resonate deeply with us, and then we go out to class, out to practice, out to national meetings, and we speak on those. We encourage people to take action. We organize opportunities for that action. Now we are activists. Yes. And yes, these position statements will come in very handy in future class assignments. So if you're anywhere right now, especially if you want to talk about planetary health or our digital health future, and I won't get started on that topic because it's too much a favorite of mine. But these are here. So I'm going to wrap up. This is a slide actually from my slide deck that I used in my CNA President-elect campaign back last spring. And when I talk about nursing, I like to always say, sure, this is what nursing needs, right? Nursing needs attention to workforce crisis. I think nursing needs increased visibility and recognition of the impact we have, not just on individual people, but the health system. And nursing needs an evolution, a policy-driven, evidence-informed evolution. But what needs nursing? And this is the thing. The planet, for sure. And if you don't believe me, you can read that brilliant planetary health position statement, anti-racist education, digital health transformation, including the integration of AI, not just into health, but into our life everywhere. Right? All of these things will benefit from nursing expertise and collaboration. I know we had a bit of an ask to talk about how those of us who came to chat with you today got to be where we are. Maybe we'll do a bit more of that in the panel. But when I used to have the opportunity to speak at our nursing graduation celebrations, I would often open with, "I never wanted to be a nurse." And then immediately the grad committee would question why they asked me to speak at the nursing grad celebration. But it's true. I didn't want to be a nurse. I didn't plan on being a nurse. It just kind of happened. And I remember my own convocation very clearly because I kind of stomped across the stage and snatched that degree right out of the poor president's hand at the end of the convocation stage. And I just was thinking to myself, how did this happen? What am I doing here? And then I stepped into the world of pediatrics as an actual nurse, not just in my clinical experience. And about 3 weeks later, it was game over. And I was in love forevermore. And I did all of the rest of the degrees in nursing. And here I am. I am your president-elect of the Canadian Nurses Association. And it's given me opportunities to do so many things. I was a journalist before I was a nurse. That's probably why I was questioning everything. But that journalistic experience leads me to still question everything. I work in nursing informatics and digital health AI. I think one of the roles I'm most excited about right now is this idea of knowledge broker. And I would like all of us to think about nurses as knowledge brokers. We hold expertise and knowledge. We share that knowledge actively to help others. We are a global force for health and wellness, and nursing is a political act. And you can keep those pictures and think about nurses on the Hill this week. There was a great article written up about nurses being on the Hill by the Hill Times, and I'm happy to share that link with you as well. But this is what I want to leave you with, and it is the power of nurses together. Together, we increase, we amplify what we can do. And our history does foretell what we can accomplish for our future. In that review of the 125 years of the International Council of Nurses being an organization, there are some incredible stories of nurses moving the world. Are there challenging times in nursing right now, in healthcare, in the world? Oh, yes, there are. But nurses are part of the key to make it better, to solve these problems, to move forward into in a more positive situation. This is speaking of that global, I can't believe this actually, Linda. Can you believe it? Does it feel like ICN in Montreal just happened? We hosted the International Council of Nurses in 2023, and now we're all getting ready to go off to Finland in June in 2025 for the next ICN meeting. But you can see a group of nurses there, and along with the Prime Minister and our chief nurse as well. And it was an incredible opportunity to feel the global power and force of nursing. I didn't make it to the hill shot, so I just wanted to share this handy selfie that the Chief Nurse Officer of Canada and I snapped a little bit illegally in the Senate tunnel last year. But you know, these are the opportunities, and again, what I think is really represented here is the joy and power of working together. Please do not wait for someone to strap these onto you. You have these wings already. You are ready to go. You have the power to put nursing to work for good in whatever part of nursing. Farah said it so well. There are endless ways that you can put this power to work. Whatever is your passion resonates with you, that is all you need for liftoff. Okay? So let's just get to work. And I would love it if you would feel that sense of connection and power. And if you want someone who's got your back, well, that's the Canadian Nurses Association. And for just $25, you can become a student member, and we will welcome you and celebrate with you all of the great things that you do for nursing. Thanks so much, everyone. Merci, miigwech. It's such a pleasure to be here with you today.
Thank you so much, Tracie, for the wonderful presentation. Right now, it's going to be the Q&A period. So everyone, the floor is open to ask any of the panelists any questions that you have. Yeah. If no one has questions, we do have a list of questions we've created for the panelists, but we'll just see if someone has any questions.
So we have a question by Christopher. So they're asking, how do current healthcare policies impact nursing salaries in Canada compared to the US? And how can we prepare for the potential increase in travel nursing among Canadian nursing students?
I'll start by answering. There's really no impact on the policies US Canada in regards to salaries. I have to say in the last 15 plus years, the US has really increased their salary for direct care, and I talk about direct care. You know, we're almost par. Some states like California is higher, but other than that, it is about par even with the dollar exchange. That's not the biggest. Negotiation is a supply and demand and how much noise you can make. Nurses do not take job action, so strike action. So if you live in Canada, you know right now there's a big Canada Post strike, and if it's not a strike, it's a lockout. I don't want to say it's easy, but it's easier for them to walk off the job. My father was a paper maker. They'd go in bargaining, they'd walk out of the mill all the time. You can't do that as a nurse. You have essential services, and there's all that professional responsibility. In regards to the agencies, I don't think many nursing students are going to go there for long, if they go at all, because the job environment is going to change. And, they're going to take a permanent job within a healthcare facility or a healthcare authority, depending on where you work. So I'm not that worried because the box has been opened, it's blown up, people are seeing what it is. But there's an impact for sure. There is an impact for sure.
There's another question by one of our CSM member, the Director of Communications. He's asking, what direct opportunities would you like to highlight? I think I lost that. Yes, what direct opportunities would you like to highlight for the students at this event? What can the students do today to engage and begin their journey?
But being involved in CNSA is a big one. I look at the opportunity that presidents and vice presidents have had, and past presidents you have had both with CNA and CFNU in the last 15 years. It's unbelievable. We need to work better into how do we transform that after you get off the board, though, because I look at Tiffany or Yasu right now, sitting with us or CNA at Prime Minister's meeting, and then poof, they fall off the cliff when they graduate. So how do we do a better job there? And then it's attending meetings. It's like anything. I say if you sit in the first row and you ask a lot of questions, that's what happened to me. I was working in intensive care. I couldn't understand why I had 2 patients on respirator, and the cleaning lady was making just a little bit less than me an hour. Went to a union meeting, talked too much, and 7 years later, I became provincial president. So, it's where you're at. So I'm sure Tracie and Farah has more answers. I'll cut my mic because if not, I'll jump on everything.
So for me to add to that, thank you. I would say definitely for students, I think it's important from the beginning. Your first clinical experiences are going to be very important to start making connections with those hiring managers, other nurses where you could develop, say, mentorship relationships. It starts, I think, year one. Don't wait till the last year to start making connections. Start making connections early. I would say get multiple mentors so that you could really see what direction you want to take. And then just pay attention during your clinicals. Is it pediatrics you want to do? Like, you'll figure it out during nursing school. And then I always say also start a portfolio early on. So, certifications, I know can be expensive for some students, but I would say save up and start getting certifications so that in your last year, if you know you want to go into critical care, you have the money to pay for, say, ACLS or PALS, and those extra certifications. And then obviously, like everyone's saying, being a part of professional organizations is going to propel you forward, not only with the connections, but with professional development. So just continue to keep learning. And then even things like just being on social media, like LinkedIn is a large professional network where you could connect with recruiters, hiring managers, and things like that. And then you can really move to other provinces too, if you want. You don't have to stay where you are, depending on, what your interests are. So yeah, thank you.
I think a great opportunity. I know everyone is very busy getting to that generalist, right, exit of your undergraduate education, if that's where you're at, or maybe you're doing some graduate specialty already. But everyone has a passion in nursing school, right? And maybe you don't know for sure, but I put a link into the Canadian specialty nursing networks, and for every specialty, right, there is a national organization, and almost all of them have student memberships, many of which are free, right? And you can check these out. You can get engaged. If you couldn't attend the Anti-Racism Summit, you can go onto the CNA website and find these recordings on our YouTube channel, right? And again, use our policy statements. A great question here. I was just typing the reply to it about what is our stand in respect to healthcare privatization. And, the CNA is a very strong advocate for a publicly funded, not-for-profit health system. But we also have an eye on our future. We also think about the amount of nurses that are entrepreneurial, right, that are creating kind of new and exciting ways that either are adjacent to healthcare or are, right, kind of in this healthcare space. And so I think it's something that we continue to engage on, right? We know that that publicly funded not-for-profit system is at the heart of Canadian healthcare. But we really want to collaborate with nurses about, what does the future of healthcare look like? And I think virtual care is another great thing that we really think about. I am convinced like that in the nurses we are so close now to having nurses who are going to graduate, write their exams, go into practice, and potentially never occupy the same physical space as a patient and provide entirely virtual care and connection. And are we thinking about that? What does the future of nursing look like in that space, and how nursing is going to be critical in maintaining excellent care in these kinds of spaces? So
Yeah, I wanted to piggyback on that quickly if I can. The US is doing a lot with telehealth, like you're saying. I actually interviewed someone on my podcast recently. Her name is Pritma. I don't know if you guys are familiar with Lavender Psychiatry. She does a telehealth psychiatry. She's based out of Calgary, but she went to Yale to get her DNP. But she's again a multi serial entrepreneur, same thing. And it's really helping, it's really helping, access to care and all those types of things. So there's so many things that could be done. I wanted to just quickly answer this question, if that's okay, about nursing schools. They asked what it would be if I could change something about nursing school. I would literally say I think every nursing school is trying to obviously update their curriculum to make sure that it's very relevant to practice and really practical. I would say that one thing would be um, I just wish nursing schools would do a little bit more of, what we talked about today, advocacy, how to really advocate. And then the other part is how to address structural racism, in the healthcare space, how to address and have these difficult conversations. And then lastly is to introduce the span of the nurse, really introducing that you don't have to just start in the hospital. You could be in the community. There's so many different roles for nursing students. You don't necessarily have to go to the traditional med surg as you come out of school. So that's what I would like to kind of see, just being a little bit more promoted in nursing school. But yeah, thank you.
If I can add on that, different and not different. I think if I could change anything in the nursing school is really giving that pride to the direct care. I find too many graduate and the questions they ask me, what can I do next to get out of it? We have to bring back the direct care as a specialty, as a place where we want to live and grow. So it's about that career pathways. It doesn't mean to build your career that you have to leave nursing. To build your career should be within workforces, and it's an S, and Farah's right, there's many others out there, but it still can be there. And I find nursing schools are very spread out, that you come out and you think, where am I going to go?
Yeah, that's a great point. I just wanted to add, I know in the US they're starting more residency programs that are specialty specific. So ICU specific nurse residency, emergency nurse specific. So I hope that Canada moves towards more of that. I know the US is still trying to improve in that area because residency programs take a long time to really develop. But I would like to see more support for that transition of practice for nursing students because sometimes they need a little bit longer orientations to really make sure that we can retain them at the bedside. Yeah.
Yeah. In Canada, we call it more mentorship programs and paid mentorship program and paid preceptorship program. And we have to be speaking more into one voices. We're still not. There's still, everyone knows that the new grad needs that surrounding, that mentorship, but not everyone's on the same solution on how it should be. And that until we get it together, yeah, it'll be interesting.
Thank you so much for answering that question. I think another one, we have a lot of questions coming in, which is really nice. People are engaging. Another question I have is from Kirsten Smith. They're asking, in relation to nursing student safety within clinical placements, or even in relation to programs associated with programs geared to nursing students, and some are provincially funded for experience, how can we support and advocate slash utilize activism to make this change and ensure this?
So I can explain that a little bit better. It's hard to explain
Yeah.
it in a message. Just explaining, for example, like provincially funded experiences, whether that's internships, programs, or anything like that. How can we advocate and act on it, especially with the activism piece, to ensure the safety of nursing students or students in those particular programs? Because I find that sometimes we do have certain standards or guidelines in place, but there are definitely gaps in the system. For example, I'm going to share personal experience. I attended a provincial, I'm in Ontario, but I attended a provincial program that was a summer program after my first year of school and nursing program. And it was expected that after first year at a long-term care home that after first year, we would know how to provide a lot of the care at a long-term care home for personal support for residents. And I actually was injured and I still have post-concussion syndrome. I was punched in the back of the head by a resident with dementia. And due to multiple reasons and factors, contributing factors, including training, lack of training, I guess, and a lot of other factors. I'm just wondering if there's a national strategy or something that we can work towards, or even provincially we can work towards to ensure nursing student safety as well as in those type of programs.
You know, you're right, and I feel for you. Look at the student nurse in British Columbia that just got stabbed. Awful. And it's all about staffing and training. And it has to start with our nursing students. And it is there because we all get some kind of occupational health and safety. We all get the violence workshop. But then when you get to the workplace, there's not enough application of it, not enough training, and not enough staffing. So you're seeing more and more discussion on how to fix that. My fear, to be honest, is that we're going to see a lot more machineries, such as metal detectors, because that's a quick fix. It's easy to spend $1 million and put metal detectors everywhere compared to spend $10 million and make sure we have adequate staff and trained staff. And when I say we, it's we as a collective, we're able to change the criminal act to make sure that now if you assault a nurse or a healthcare worker in Canada, the healthcare workers coming up there, but a healthcare worker in Canada is the same thing as assaulting a police officer. What is missing is the training. And that's the training for nursing, but also police forces and employers. So it is moving in the right direction. And I think for you to speak up and use your voice, you become an expert witness. You know, it happened to me in first year. And people will look and say, okay, that's not Linda Silas complaining about God only knows what. It's a real nursing student. It happened to her in first year. You know, I had a bad stretcher when I was working in the ER way back, and I torn everything there. And you know, still 30 years later, it's still chronic pain. And I remember my director of nursing saying, Linda, we don't have those old stretchers now. I said, come at 2 a.m., you'll see that old stretchers are there. But they're not there today, I guarantee you that. But you know, but it's almost like they don't believe you. So just keep telling that story and it will click, like that the story in BC of the nurse getting stabbed. Unbelievable. Like somebody went into a healthcare facility downtown Vancouver with a knife. And police responded right like this. Why? Because it was downtown Vancouver. They're everywhere. I guarantee you it would have been in Prince Rupert or New Brunswick Regional Hospital. They wouldn't have been there because it takes 30 minutes or plus.
It just, with my particular experience, it's just it I know we have to bring the science behind it, but I also feel like I'm one out of like one person, and I feel like I don't know. It needs to be a collective voice, right?
Yeah, it is. If you look, I know we speak about it. I know CNA spoke like 60% of nurses were coming out with a new survey where we'll be in the field in January, it'll come out in March, but 60% of nurses say they've been physically assaulted. And that they go back like a year. Don't quote me on it. All the research is on our website, but it's for us to put the numbers out and it's for you to tell the stories. And because your stories are more than stories. When Farah was talking about your personal stories, I marked immediate expert witness, and it is bringing that story up.
Yeah, and I just wanted to piggyback on that. I know globally there's issues with workplace violence, especially in certain areas like, geriatrics, ER, critical care, these places. But I guess the best thing I would advise to all nursing students is just to have an increased amount of situational awareness, and then just be aware and like also look out for your other nursing students, or if you see something that doesn't seem right, speak up, and just like have a distance, and then like, de-escalation techniques and stuff. But it's hard with the geriatric population, or, if they're intoxicated, or on drugs, some of these patients. But I think the biggest thing is just having that situational awareness. And then just speaking up to the hospitals to see, because there's a big issue with reporting too. There's a lot of under-reporting because people think that if I report, it's a lot of paperwork and then nothing's going to happen. But I say still report it, and then just have an overall like situational awareness and just look out for each other type thing. Yeah.
And remember, it's okay to say no. I'm not entering an unsafe working condition. Either I'm not trained or I don't have the appropriate staff. We do not say no enough. We accept the abnormal like it is. Well, I have no other choice. I'm a nurse. Imagine that almighty nurse that you think you're superwoman, superman. We are not. You're a human being that has rights like everyone else, and we're allowed to say no. There's not a college or a school that will reprimand you if you entered an unsafe working condition and then you walked out of it to protect yourself and honestly to protect your patient.
Yeah, and I want to add, some places will almost make it seem like, well, that's kind of part of the job, but it's not. So don't let anybody make it seem like, oh, well, they threw something. Okay, that's fine. Like, that's just part of it. It's not. So like you said, setting those boundaries is important.
Yeah, that's what I received.
Yeah.
Comments. So it was the culture, I think, as well. But it was also a contract as well, position.
Yeah. Oh, it's hard. Don't get me wrong. It's hard to say no, but you have to think about yourself. When I was a nursing students and new grads, we had doctors that would come in and it would be okay for them to roll their hands down your back. You'd give them your chair, because they walk in. That Tracie's laughing. Tracie only read about it, but it used to be a culture that was accepted in nursing. As soon as the doctor, especially surgeon, walked on the unit, you were working. You'd give them your chair. And there were sexual innuendo, whatever that word is, like all the time. That at least doesn't happen. If it is, it blows up quite quickly. But the violence, the unsafe, there's still work to be done there. We have a big report on our website, the hours of work. It is unsafe for a nurse to work more than 12, 13 hours a day, similar to pilots, similar to train conductors. But nurses tell us, oh no, Linda, I'm dedicated. I'm committed. I can't leave my patient. Well, you're going to kill yourself or get sick or do a major error, and then you'll lose your license. So if it's good enough for a pilot, it's good enough for nurses, and we just have to stick to our guns on it. The other part is a lot of nurses, not you folks, because you're just starting, are addicted to the overtime. And that is not good for them, and it's not good for the profession. Tracie's laughing because imagine the union president telling members, you are addicted to overtime. You need to stop. Those, I don't get many applause when I say that on stage, but it is a reality, and we have to change that thinking.
I was just thinking about how long it takes most nurses to be able to go pee on a shift. And if that's part of our healthy work environment that we potentially need to change. That's how all nurses who are giving report, that's the first thing I used to ask coming on tonight. I'm sorry, what time did you pee today? 3 o'clock? Oh no, I'm not gonna stay for tonight, I don't think, right? But I mean, this is the thing, right? This is that dedication. It's in really sneaky, quiet ways. Nurses do not tell their own stories enough. And even some of the stories that have been shared here and the thoughtful questions that you're asking and the engagement that you have, we need to tell our own stories both individually and collectively. And then, first of all, so people feel like they have a home, and you always do, and you always have a point of connection, but also so that, right, the rest of the world comes to understand the value, the importance, and the power of nursing.
Look, it's easy to see that Farah is a real podcaster. She has the big microphone in front of her.
Yeah, my husband got me that. Yeah.
The office got me one during the pandemic because we were doing a lot. And I said, what do you think? I'm going to travel with that? I'm never in the same place at the same time. Well, so it's a nice decoration.
Okay, thank you so much. I think we'll have to wrap it up now. Thank you, Linda, Farah, and Tracie for kind of joining in on this leadership panel. It was really insightful, and I'm sure all of us kind of learned a lot, and we'll be taking away some key points in how we can inspire to be better leaders in nursing, and also things that we can consider as we move forward as nursing students and future nurses. We do have a draw for 2 gift cards for everyone who attended the session. I will let Mianj do that. And then after the draw, we have palliative care session and a resume building session, which will be happening in the breakout rooms.
Or
I see Kirsten.
Farah wanted to take a picture.
Yes.
Okay?
Oh, yes. Oh, yeah.
That's why I just raised my hand.
Okay. Yeah, I'm so sorry. I completely forgot. We can definitely do a picture.
Yeah, if you'd open your cameras, that'd be good.
Yeah, if everyone could turn on their cameras, that would be amazing. There are multiple pages, so just getting them all in, and I'll send the pictures.
Thank you, everyone.
Thank you, and don't quit. We'll win. Bye-bye, bonjour. See you in the end of January in Halifax.
Okay, I also see like Kirsten was having her hand raised. Like, do you have something to say, Kirsten?
Sorry, I just have to. Nope, I don't have my hand raised.
Okay, perfect. Okay, so the spin wheel is ready. As promised, people who are engaging, people who have the cameras on, get the double entry. So it's already listed there. We have two gift cards, so we'll announce like two. Let me know when you can see my screen, okay?
We can see your screen.
Perfect. Okay, let's
And these
start.
are $50 Figs gift cards, just to clarify.
Oh, we have our first winner, Christopher Fernandez. I see Christopher had his camera on too. Christopher, if you could hear us, if you are here, just send me your email address and I'll keep a record of it and I'll reach out to you with a gift card as soon as possible.
Okay. I think there is one more gift card.
I received the text. Yeah. Okay, let's roll.